to the Center for Healthcare, working in north and east of Sri Lanka, and also water purification tablets from India, and water purification machines, and also birth of medical supplies shipped from USA with the help of USAID and Operation USA. And we also continue to work on the preventive health side. One of is the nutritional side. What is health? The state of health, the WHO definition is not just the absence of disease, but it's a complete well-being. Physical, mental, and social well-being is a state of health. So we are working towards that. So in Canada last year, we started a Canadian chapter in April 2008 with the view to help the malnourished pregnant mothers to get additional nutritional supplies in north and east of Sri Lanka. So we contributed 78,000 for that. And also for the preventive aspect of it, so the nutritional deficiencies, we cannot keep on going feeding the malnourished mothers and people. We need to educate the people from the grassroots level for the prevention. For this, we started project on nutritional education for the high school students in north and east of Sri Lanka, and also nutrition for the homes, for the orphanages in north and east. So our maternal nutritional project for the pregnant mothers when they come for the first antenatal checkup is a global medical routine to check their height and weight, and when they found to be malnourished, we consider, and Sri Lankan started the body mass index, it's less than 18, identified during their first visits, and they were given extra supplement. The cost for the supplement for the next few months until their delivery is $100 per pregnancy. Also, we did help a microcredit program, mainly in the eastern region, for the widows to start their new life, to become economically self-reliant, to start a poultry or buy a sewing machine or putting up a shop. Also, we know about the medical inadequacies and crises there, so we need to have our own personals. So we are helping the medical students. They are sponsoring medical students. It's costing $50 per month and $600 per year to sponsor a medical student to complete the medical studies back in Sri Lanka, University of Jaffna, where I came from. Also using incentive allowances, certain difficult areas, offshore islands and some of the difficult parts, the doctors won't stay long to work there. So we, IMHO provided an incentive allowance, extra $100 per physician. That really worked, especially in the areas like Velanam, Kites and other areas. The doctors staying longer than the initial period. So it's working well. So the sustainable health systems, we are helping to provide for the people in these difficult areas of the north and east. And also we are conducting mobile clinic in the Valikamam West area in the north, in Jaffna, with our ambulance, the medical staff, and they travel to the different location conducting the mobile clinics, preventive health and the treatment for the ailments. And the cost for giving medical treatment for person is 50 cents to $1. And also we equipped the cardiology unit in the Jaffna Teaching Hospital with portable echocardiograms, pacemakers, and other instruments necessary for the cardiac investigations. And also this is one of the cardiac catheters in laboratory. North and East Province, the people, Tamil people in North and East Province, and not only from North and East, from all over the world, more prone to get the coronary artery disease. And until this time, the province did not have a cardiac catheterization lab. So for the investigation like angiography or angioplasty, they need to be transferred to the south of Sri Lanka, and it's not possible, especially with the transport difficulties we experienced for many years, last few years, as well as with the recent crisis situation. So with the help of our professional body, CMDDA, we We are planning to fund this cardiac agitation lab. It's worth of $1 million US. It's going to be implemented soon. It's not only for the angiogram, it's also if it's implemented or when it's implemented, it will also help for the simple cardiac procedures like closure of congenital defects, balloon valvuloplasty, and etc. This is further help to the Jaffna Teaching Hospital. It's state-of-art diabetic center. It became functional a few months ago, and also an autoanalyzer for the laboratory. Nephrology units with equipped with a dialysis unit. Also outpatient chemotherapy center. It was supported with the transport and extra nutrition. Cardiology high dependent units with the 8 beds available for the people after the myocardial infarction or major cardiac events. And also portable echocardiogram and pacemakers, and also supporting the professionals, the medical professionals there with telemedicine. And we are also funding them for the further training for the physicians and nurses. The other projects in the Jaffna Peninsula here, once I mentioned before, the nutritional support for the pregnant mothers, it costs $150,000 per year. Psychiatric unit and alcohol recap and telepalai cost $30,000, and also our mobile clinic is $32,000 per year. Nutritional supplement for the orphanages or homes for the children, that's costing $20,000 per year, and also extra medicines needed for the hospitals and for the mobile clinic $70,000, and incentive allowances for the physician $8,400 per year. Projects in Batticaloa, these are the details of projects in Batticaloa district. Pediatric ward and a psychiatric units were built in Batticaloa hospital, as well as the unit in Kalmuna, and also physician training and assisting the internal displaced people during the last year and before. During the displacement, all the microcredit program for the widows which we showed before. So this is our past history. I presented this one because many of us here, especially in Edmonton side, has not heard about IMHO or heard sometimes not known fully or well about what this organization, what it's doing and what it is for. Now we come to the current humanitarian crisis in Venni. This is the current statistics we got. The figures change day to day. So it's the figures at the time we prepared the slides. So age group, if we see that less than 5 years old or 5 years old children, about 57,000 children there, and also more than 60 years is 25,000 people more than 60 years. So both are very vulnerable group, and not a good place to be in this internment camps for a longer period of time. This is the current state of IDPs. 58,000 children there, 10,000 malnourished among them. 1,000 of them are orphans. They lost both of their parents. 8,000 widows, 3,000 pregnant mothers, and 350 of them are due this month of June. And the amputees about 25 to 30.